It's amazing how many areas of the body can be affected by a rotated pelvis. And many people don't even know that they have a rotation in their pelvis. When the pelvis gets rotated forward in an anterior rotation, typically due to tension in the front of the hip flexors, the iliacus, and the psoas muscle, that rotation will pull the pelvic bone forward in this direction. And because of that rotation forward, it changes the way that the ball fits in the socket of the hip joint, which changes the whole trajectory of the leg. In addition, because of that rotation of the pelvis, it's also changing the rotation of the spine, which can work its way all the way up the spine. And this is really the major topic of my book, Tight Hip Twisted Core, The Key to Unresolved Pain. I go through all the details, but I just wanted to give everyone a little bit of a highlight of some of those things that you might expect if you end up having a rotated pelvis. So I'm going to stand up here a second and kind of show you. If your pelvis is rotated forward anteriorly this way, what will happen is that leg will hyperextend, your knee will hyperextend, and that will cause irritation in the knee joint itself and the meniscus. In addition, with that hyperextension, there'd be a rotation inward. So if you can see, my leg kind of rotates from here inward, which would cause strain to the inside of my knee. So stretching, irritation can irritate the meniscus, can irritate the ligaments, the MCL, and compression on the outside of the joint. So that would be irritation, arthritis, the outside of the joint. Then you would have what happens, this rotation here is it rotates your leg bone, your tibia inward, which causes more pronation on the bottom of your foot. That pronation can irritate the bottom of your foot, creating plantar fasciitis. You can also end up with a bunion where this toe will kind of go in. So the whole mechanics of that change. It can do other things too, like can affect your ankle, it can cause tension in your shin, etc. If you go back up to the hips, that pelvic rotation forward will irritate the SI joint because it's pulling the pelvis forward, the tailbone stays kind of stationary. That rotation forward will put strain on the SI joint where the tailbone and the pelvic bone meet. Also, that rotation will cause strain and tension in the quadratus lumborum, low back pain, low back tension, and can work its way up the spine, even creating irritation of the nerves. So other things that you might notice if you have a rotated pelvis is that when you lie down and you're completely flat, one leg might be shorter than the other. So in this particular situation, if my right side was rotated forward, it would appear longer when I'm lying down. And then when I go to sit up, it would appear shorter. Now this is hard to tell on your own. Sometimes you need a practitioner or a friend to tell, but sometimes it's drastic enough that you can see that. Another thing that you could notice is if you bring your knee up to your chest and try to pull your knee up, there'll be some pinching in your hip. That's a sign of an anterior rotation in your pelvis as well. In addition, if you go to lower your leg straight, using your hip flexor, a lot of people feel a pop in their hip, and that's another sign of a rotation. So these are some things to just get you started to try to figure out whether or not you have a pelvic rotation. And really the two main things that are super important for you to keep your entire body healthy is to make sure that your core and your neck are relaxed and the tension in those two areas are relaxed because they affect everything else. And then in addition, that those two areas are aligned. Because if one of those two areas are not aligned, it can affect the whole chain. So you might be having, toe pain, you might be having shoulder pain, you might be having pain in different areas of your body, but because the body is so connected and these two areas are the key cause of so many of these areas, it's very important to kind of understand how those do impact the rest of the body.